Do you know past traumatic life events could control your current mood and mental state without you realize it? Post-traumatic stress disorder, or PTSD, is a mental condition which usually occurs when you experience a traumatic and stressful event in your lifetime that you can't mentally handle it. Serious events like war, sexual abuse, childhood violence, car accident, people's death, natural disasters like earthquake are some triggering factor of PTSD. This condition takes place after someone experiences or witnesses a traumatic or terrifying event involving serious physical harm or the threat of it and feeling totally helpless. PTSD usually is triggered by a tragic situation happened to you, or happened to someone close to you, or even you just witnessed. Here are some clear examples. 1. Participating in military combats, or living in an area with continuous military conflicts. 2. Any kind of abuse during childhood such as physical, sexual or violence. 3. Natural disasters like floods, earthquakes or hurricanes. 4. Man-made tragedies such as bombings, air raids, plane crash or shooting. 5. Serious car or motorcycle accidents. And 6. Violent personal experiences, such as mugging, rape, torture, and being prisoner of war or kidnapped. There are some risk factors too, which are separate from triggering factors. But these ones could reduce the person's mental capacity and his resilience against critical situations significantly. 1. Lack of family or social support. 2. Repeated exposure to traumatic and stressful circumstances. 3. Family history of mental health disorders like depression. 4. History of childhood trauma or abuse. 5. Personal history of an acute mental trauma, like a relationship breakup. And 6. Previous mental or mood-related disorders like paranoia or borderline. Symptoms of PTSD should last at least for 1 month. And the person must have experienced a mental trauma before. 1. Nightmares and other sleep-related problems. 2. Feeling guilty, worried, frightened or anxious without obvious reason. 3. Continuous unwanted flashback of the trauma's memories. 4. Bursts of anger or irritation for such unimportant things. 5. Strong physical or mental reactions when you're reminded of the trauma, or even without clear reason sometimes. 6. Concentration and learning problems. 7. Intrusive thoughts about combat, death, killing or harming yourself or others. And 8. Staying alert all the time, and too much sensitivity for external stimulants like sudden sound. Not necessarily every person who experiences a trauma develops PTSD. It is possible that it starts several weeks or even a couple of months after the trauma happened. The symptoms should last at least for 1 month, and some of them may look like other mental health conditions. So before making any change to your routine lifestyle, you should consult with your psychiatrist or psychologist. The treatment process includes a mixture of medications and non-medication methods. Medications like SSRI, antipsychotics or benzodiazepines are really helpful. Remember, deep and severe mental discomforts usually need time to be healed and totally recovered, so if you see no significant improvement at the beginning of therapy, don't worry and just carry on the process according to your mental health provider. Thank you my friends, and take a good care of your mental health.